Hello. I have nothing to disclose. And my talk's about the natural history of elevated post-void residual urine volume. Elevated residual urine volumes often found incidentally, but there's uncertainty about management. Olmsted studies showed that high residual urine volumes tend to decrease over time using a regression model. From that, we speculate that most cases of elevated residual urine volumes may resolve naturally without causing complications. But no study has reported the natural history of different levels of elevated residual urine volumes. Our objective is to describe the natural history of residual urine volumes in older men living in the community. We used data from a CHAMP study, which is a cohort study of a representative sample of men aged 70 and older living in the community in metropolitan Sydney, Australia. We collected data at baseline, 2-year follow-up, and 5-year follow-up using self-administered questionnaire and clinic visit, which included IPSS and ICIQ, uroflowmetry, and post-void residual urine volume. In addition, men were telephoned every 4 months to ask about hospitalizations since the last phone call. Residual urine volume was measured using a bladder scan portable scanner and were considered valid if voided volume were more than 150 mils. Residual volumes were categorized by volume, as shown here. We conducted 2 analyses. The first one was the incidence of events related to elevated post-void residual urine volume, indwelling catheterization, and surgery, cavitating prostate surgery for prostatic enlargement, potential treatment for elevated residuals, hospitalization for UTI, and urinary retention, potential adverse outcomes of elevated residuals. The second analysis is the change or shift of residual volumes between volume categories at baseline, 2-year follow-up, and 5-year follow-up. This chart shows exclusions. Men who were followed up for 5 years were included in the analysis. Neurological disorders, prostate cancer, cavitating prostate surgery, and urological medications were excluded because these might affect residual volumes. Men who had valid baseline residual data were included in the incidence of related events analysis. After excluding men who received urological treatment during follow-up, men who remained urologically intact, who had valid residuals data at both follow-up points, were included in the change in residuals analysis. This is the baseline characteristics in the men included in the analysis. Mean age was 75, IPSS was 6 points, 15% had diabetes, and 8% were using medications with anticholinergic effects such as antidepressants or beta blockers. This is the result of the first analysis. which is 5-year incidence of events related to elevated residuals. When we look at the cavitating prostate surgery for prostatic enlargement, in men with baseline residuals of up to 400, only 15 men, which is 5%, received such surgery. In the 4 men with baseline volume of 400 and over, 3 out of 4 men received such surgery, one of whom also received indwelling catheterization after the surgery. Not many men were hospitalized for either UTI or urinary retention, and there was no association with baseline residual volumes. This is the result for the second analysis, which is the changes of post-void residual volumes over 5 years in men who remained urologically intact during follow-up. Baseline residuals of 0 to 50 remained, did not exceed 400 either at 2-year or 5-year follow-up. Baseline volumes of 50 to 99 did not exceed 400 mils either. Baseline volumes of 100 to 199 did not exceed 400 mils either, and shift toward lower residual volume categories were commonly observed. Baseline volumes of 200 to 399 did not exceed 400 mils either, and only 1 man had a baseline volume of 400 and over, and his residuals remained high. To summarize our findings, in men with residual urine volumes of less than 400, only 5% required cavitating prostate surgery for prostatic enlargement or indwelling catheterization following 5 years. And in all the men who remained urologically intact, residual volumes did not exceed 400 mils over 5 years. In conclusion, a majority of men with incidentally found elevated residual urine volumes of less than 400 may be managed conservatively at least for 5 years. Thank you very much.
Thank you. This paper is now open for discussion. Please proceed to the microphone. Please.
Yes, a very nice study.
Yes.
Very quick question. Did you measure by any means the size of the prostate or the configuration of the prostate in those men, particularly the one that you say below 400 milliliter? Size of the prostate or configuration of the prostate inside the bladder?
Because this is a population-based study with really large sample size, we couldn't conduct such invasive examinations. So unfortunately, we don't have either data about prostate size or prostate configuration. Thank you very much.
There's another question.
Great question.
Thanks. Bill Gibson, University of Alberta. The majority of patients with UTI are not treated in hospital. Did you measure incidence of UTI in the community-treated population?
Thank you very much. We only had data about hospitalizations, but no use of medical resources or medication use between the follow-up visits. So unfortunately, our data is limited to adverse events severe enough to require hospitalizations.
Peter.
Hi, good morning. Peter Roos here from Utrecht, Netherlands.
Yes, post-void residual, and I accept the situation. But what were your instructions for the voiding? And what was your evaluation of the representativity of the voiding? Were they allowed to void in privacy in a normal situation with a normal sensation of urgency, the need to go, and was that in any way representative?
Thank you very much. Men could void in privacy, but not in a toilet or in normal situation. We lost a lot of samples because we didn't give instruction to drink water before the examinations because we also had a fasting blood test, and we decided that it would confuse men if we said, if we told them to not to eat but drink plenty of water. We lost a lot of samples, but as a result, we could observe natural voiding instead of from artificially distended blood gas.
Okay, just one more question.
London, can I just ask, what is more important is what happened to the people who dropped out and needed urological surgery? Because if you watch, you had people who had low IPSS scores, you then followed them, and then the post-void residual did not do anything because there was no intervention. What is more important in the people who did not, who then went on to have intervention, the outcome of not intervening. Because for us, that's more important. Do you have any data on that? What happened to those people who then needed intervention?
Yes.
If by not intervening, then
Yes.
harm came to them.
We do have data for people who received urological intervention, and because the sample size was small, we didn't observe any tendency such as they had more hospitalizations for adverse effect or know that their residual urine volume kept increasing. Maybe it didn't answer your question.
Okay, time is up, so thank you for that presentation.